Today we are talking all about arthritis and how to move and exercise when you do have arthritis. Let's get started. Today we're talking all about arthritis, and I'm going to give you some ways that you can move and exercise when you are experiencing arthritis. This is such a common condition. In the United States alone, there are over 58 million people who suffer from some type of arthritis, and 1 in 4 adults are diagnosed with arthritis. So I want to go through a few types of arthritis, some symptoms you might have, and then some ways to move. So there are actually over 100 different types and categories of arthritis. So we're just going to discuss the few most common. One is osteoarthritis, and that's what most people experience. So that is typically, in the past, it's been considered a breakdown of the cartilage in a joint. But now we understand it to be so much more than that. There is inflammation involved when you do have that arthritis in a joint. The most common joints that are affected are hands, hips, and spine. I see it a lot in the knees as well in physical therapy. And we understand now that it can actually start to break down not just the cartilage in a joint, but also the bones surrounding that joint and the ligaments and the muscles involved as well. So it really is a full joint issue when you do have osteoarthritis. One other thing to keep in mind with osteoarthritis is many times it will be only isolated to that joint. It doesn't mean you don't have it elsewhere. You might have it in both knees, you might have it in both hands. That's really common. But many times it could be isolated to one joint, especially if it's post-traumatic, meaning you had an old injury in the past, right? Like one of those knee injuries that just has constantly bothered you. You are more likely to develop osteoarthritis in that joint. So it could be isolated to one joint. But again, it's kind of that overall breakdown of the cartilage and even the bone and the muscle around the joint, causing inflammation, stiffness, and pain. And then another category of arthritis would be an inflammatory and autoimmune arthritis. So that's where we find our rheumatoid arthritis, juvenile arthritis, and even gout are considered that autoimmune kind of arthritis. And that is going to be handled a little bit differently, and it also presents a little bit differently. So most of the things I talk about today in our video are going to be around osteoarthritis, but they can also apply to these other categories. Just keep in mind, osteoarthritis is the most common. And if you do have symptoms of those autoimmune arthritis issues, I definitely want you to go check in with a doctor and see if there's other ways to help you as well. So the most common symptoms you're going to see with arthritis are some of the things we've talked about already. You're going to get some inflammation, maybe even some swelling that you can see, possibly some redness in the joint. That is going to be more common with rheumatoid arthritis, especially that idea of a lot of swelling and redness. You may feel stiffness, especially more so in the morning, and get pain in that joint, which could lead over time to decreased function and decreased strength. So basically you start to be a little more afraid of movement. You might find things like getting on and off the floor a little bit harder, getting out of bed in the morning a little bit harder with that stiffness and with that pain. So those are the most common symptoms that you're going to find with arthritis. So when it comes to managing and treating arthritis, one thing to know is that we currently do not have a cure for arthritis. There are many ways that you can manage it, but there's not a true cure. So that brings us to a place of learning these management techniques and it becoming really important for you to take some ownership and to feel empowered in these conditions. I don't want you to feel like it means that you can't move anymore, that you can't exercise. Exercise is actually one of the most recommended things when you do have arthritis. So let's talk about some of the things that you can do to feel better. So today I'm going to mostly talk about exercise and movement. I'm a physical therapist. That's where I go. That's the way I work with clients. But I do want you to keep in mind there are many other lifestyle management techniques that you can use with arthritis. Check in with your doctor, see a healthcare professional, maybe do a search, but there are things such as diet and supplements and medication that can help with arthritis that we have literature on. even surgery long-term, which I know that can sound scary, but when you are in enough pain, things like a total knee replacement actually can help if it's the last resort. So definitely talk to your healthcare professional about those, and let's get into exercise and movement. So the biggest thing that is going to limit you is simply your pain and possibly your stiffness. I want you to go off of how you feel. When you have arthritis, I don't want you to push through that pain, right? That idea of no pain, no gain, that is not going to help us in this situation. So if you are having a flare-up of pain, if you're experiencing pain in your joints or because of your arthritis, I don't want you to push through that to do a workout that you think you should do. That being said, you also don't necessarily need to find arthritis-specific workouts. If you go through my entire YouTube channel and my Unlimited, where I have hundreds and hundreds of workouts, I don't know if I have any specific arthritis-specific, because people with arthritis can do just about anything else as long as your body tells you that you can. So again, I don't want you to push through pain. I want you to avoid things that cause pain, but also know that by strengthening around that joint and strengthening the muscles, you can actually help decrease the progression of the disease, and you can help your pain itself. So things like, I have a Pilates knee-friendly workout. So it's friendly for the knees with no kneeling. Those kind of workouts would be really appropriate and really helpful if you have arthritis in your knees and you are having pain. So finding workouts like that might be really helpful. And then times that you're feeling good, that it's not flared up, learning how to do a squat. So finding like a beginner leg weight workout is actually really helpful as well. You're going to strengthen your glutes, strengthen your hamstrings. You're going to strengthen all the muscles surrounding the knee joint so that it's supported, so that it actually doesn't have as much pain when you get on and off the floor and climb up and down stairs. So it's really important to progress your strength, to find a variety of workouts, to even use weights. It's important to do that in a way that feels safe and non-painful to you. So those are the workouts that I want you to seek out. If you're having a flare-up of arthritis in your hands, which I know is really common, you might want to avoid planks and push-ups and things like that. Find light hand weights that feel okay to grip, and go ahead and start to strengthen in those ways. And then once you feel a little stronger, once that arthritis flare possibly has come down, you can get back into those activities again. So arthritis really does take you doing a little bit of legwork to find out what feels good, what you might need to avoid, and creating a safe, consistent exercise program to, again, strengthen the areas around those joints and muscles. And in the meantime, while you're working out, you can use things such as ice or heat to help support the joints as well. There's a lot of literature out there, and it's typically recommended with arthritis that you can use either ice or heat. So use those as they feel appropriate to you. So I am going to put some links below to some workouts, like I mentioned, the knee-friendly Pilates workout that might be really appropriate during times that you are having a flare-up of some pain or arthritis. The biggest thing I want you to remember and keep in mind is that I want you to find ways to feel empowered, to feel strong. I don't want you to feel that you, just because you have arthritis, you have a sentence of not moving the rest of your life. That is not true. You need to keep moving. I want you to keep moving. We just need to find ways to support your body and that you help it as it helps you along the way. I am so happy you joined me today, and I will talk to you soon. For even more information about arthritis and how to manage it and move while you have arthritis, check out my podcast, Meet Your Body. I have a full episode all about arthritis coming out on Wednesday, February 8th. Link is below.